Hey everybody, Dr. Patel here. Sorry about the delay in getting started here. I'm having a little bit of technical difficulties and you're unfortunately not going to be able to see my pretty face today. I don't know what's happening with the video, but it is what it is. The show must go on. So today we're going to be talking about the top 3 causes of sciatica. What are the things that can cause sciatica? First of all, what is sciatica? What's the pain associated with it or the symptoms that are associated with it? And then what is it that can actually cause this to occur? And once we realize what it is that can cause sciatica to occur, what is it that we can do about it in order to make it feel better? So first and foremost, what is sciatica? Since you can't see me, you're going to have to deal with just looking at this blank screen. No, you're gonna have to deal with me just drawing, and we'll go from there. So when we talk about sciatica, what we deal with is essentially pain that is going down the leg. When a lot of folks think about sciatica, we're thinking about either pain in the butt or pain down the leg. But in true definition, where exactly do we feel the pain? Well, it's typically pain that's in the butt and down the leg. That's my little guy here. You're gonna have to forgive me. He's a little bit shoddy here, but there's the butt, right? And when you have pain that is in the butt itself or going down the butt, down the leg, that's what we typically think of as what sciatica is. Now, some people think of sciatica as just pain in the butt itself. A pain in the butt could be sciatica, but pain in the butt could be a lot of different things. It could be pain from the low back, it could be pain from the hip, it could be pain in the muscles of the buttock. There's a lot of different things that could be causing a pain in the butt, but when we strictly think about sciatica, we're talking about irritation to the sciatic nerve. And that's a nerve that travels down the leg, and irritation to that nerve can cause various symptoms, not only in the butt, but going down the leg altogether. So what does that mean? Well, the sciatic nerve, to understand that fully, the sciatic nerve is a big old nerve that travels through the buttock and down the back of the leg, and it comes from several different nerve roots in the low back. So the L4, L5, S1, S2, and S3 nerve roots all come together to form this big nerve called the sciatic nerve, and that travels down through the buttocks and down the leg. Irritation to the sciatic nerve can cause symptoms in various different ways. The 3 most common ways that nerve irritation can present is, number 1 is pain. Typically that's pain that could be in the butt, it could be down the back of the leg, it could be down the side of the leg, it could be down the thigh, the lower legs. It could also go all the way down into the ankle, foot, and toes. In fact, some folks that have only ankle, foot, toe pain may actually have irritation to the sciatic nerve. Even in the absence of anything in the butt, and even in the absence of anything in the low back, even just foot and ankle pain can present in that fashion, but actually be coming from nerve irritation along the sciatic nerve along its course. But again, the typical thing that people think about is pain in the butt or pain shooting down the leg. People will describe electricity shooting down the leg. People will describe feeling of muscle tightness down through the leg. Or even people will describe that it feels like a deeper kind of bone sensation that travels all the way down their leg, or sometimes even just skips different areas, right? You have pain in the butt, it goes into the back of the thigh, and then it skips the knee and goes to the bottom of the ankle or foot or something along those lines. when you have things that are going on pain-wise down one leg, then sciatica might be a concern. Now, nerve irritation can also cause two other types of general categories of symptoms. Number two is it can cause numbness or tingling. So this could be numbness, like you actually can't feel, like you're actually pressing on your leg, you're pressing on your foot, and you actually have some decreased sensation there. That can be your numbness. Or tingling, it can manifest as, ants crawling down your leg, or buzzing sensation, or a trickling of water sensation, or even a sensation like your leg has fallen asleep, right? If you're sitting for a long time, or you're sitting on the toilet or something along those lines, and your leg falls asleep, right? That kind of sensation, it falls into the category of numbness or tingling that's associated with nerve irritation. So finally, number three. So number one is pain going down the leg. Number two is numbness or tingling down the leg. And number three is weakness. Now, when I say weakness, I don't necessarily mean you're dragging your leg around, although more nerve damage can present as gross, overt weakness, like your legs giving out from underneath you, or you don't have the strength to go up or down stairs, or your foot is dropping, right? Your foot is slapping against the ground with every step you take, or your toes are dragging with every step that you take, right? That's the kind of overt weakness that's associated with more significant nerve irritation or nerve damage. But even subtle weakness can be appreciated with the appropriate physical examination, or you can appreciate it if you're wary of the signs. So what do I mean by subtle weakness? Some patients will have your foot flattens out on one foot more than the other, right? If your foot is flattening out on one foot more than the other, and that's not associated with the previous injury in the foot or something along those lines, that could be because the muscles that make up the arch of the foot are actually weaker on that side, and therefore with every step that you take, that arch actually collapses more, so you have more flat-footedness on one side or the other. That could be a sign of nerve irritation causing some subtle weakness in the muscles. Similarly, if you start noticing you've got a bunion that's forming on one foot more than the other, again, that could be a sign that we're putting abnormal pressure into that foot over years, and that could actually cause your toe to bend outwards and cause that bunion to form. So if you're noticing that your bunion is occurring more on one foot or the other, then that might be a sign that there's some nerve irritation as a piece of the puzzle. And finally, if you're working out and you notice that, I'm doing squats and my left butt is firing less than my right butt is firing, right? Or if you notice that you're doing squats and your left knee goes inwards more than your right knee, then this could be a sign that the buttock muscles are weak, that there's some subtle weakness that's going on. And these are the type of things that we commonly see with nerve irritation, not necessarily nerve damage, but nerve irritation that's associated with sciatica. So now that we know the symptoms that are associated, right, with the three common symptoms being pain shooting down the leg, numbness or tingling going down the leg, and then weakness in various muscles down the leg. Well, if those are things that could potentially be coming from sciatica or sciatic nerve irritation, and we know now that the sciatic nerve comes from the low back, several different nerve roots, comes together to form a large nerve that goes into the buttock and down the back of the leg. Well, what are the things that can commonly cause sciatica? There are several things that can cause irritation to the sciatic nerve or the roots that make it up. But there are three broad categories that I like to think of when I see somebody that has sciatica type symptoms. The first thing that I think about is the spine itself. I always have to wonder, is there something in the spine that is causing irritation to one or more of the nerve roots that make up the sciatic nerve? So what do I mean by that? Well, there's a lot of different things that can cause nerve irritation. For those of you that have seen some of my prior lectures, I talk about the spine as like a stack of coffee mugs on top of each other, and these are funky coffee mugs where the handles touch each other on either side, and we have the disc in the front, and in between the disc and the facet joints, right, these are the facet joints here, and this is the disc right here. This is the front of the body, this is the back of the body, and behind the vertebral bodies is the spinal canal, and the spinal nerves exit in between the discs and the facet joints on either side. I just noticed my coffee mug handles kind of look like ears. They're not meant to be ears, these are coffee mug handles. Anyway, so in between the facet joint in the back and the disc in the front, right, facet joint in the back, the disc in the front, the nerves exit and go down the legs in different distributions. Well, these nerves are the ones that kind of come together to form your sciatic, your sciatic nerve, right? So they come together and then all form the sciatic nerve. Now, if these nerve roots are getting irritated in any way, shape, or form, right? If you have a disc bulge that's going on here, or if you have some facet joint arthritis that's narrowing the space where the nerve is traveling, well, if this nerve gets irritated right here, then that can certainly cause some pain, some numbness, some tingling, some weakness that's associated with kind of that sciatica type symptoms. And this could be at one nerve root level, this could be at multiple nerve root levels, but this is one of the more common causes of your quote-unquote sciatica. Now, textbook, this isn't technically sciatica, right? Because this isn't the sciatic nerve itself that's injured, but rather some of the nerve roots that are contributing to the sciatic nerve. But when we have these symptoms that we kind of label as sciatica, we can't forget to look at the spine. That is one of the most common things that can be an issue. Okay. So if it's not the low back, then what are the other two things that are the most common regions, right? I mentioned that the sciatic nerve comes from multiple levels of the low back and then it goes down through the buttock. Well, there's certain things that are in the buttock that can cause symptoms. One of the main things that a lot of folks kind of point to when we think that we're having sciatica or nerve irritation is actually the piriformis muscle. So the piriformis muscle is the muscle that attaches from the bottom outside of the sacrum, which is the base of the spine, and travels all the way out to the hip bone. So this is kind of a back view of the spine here, and these are the vertebral bodies, the bones. This is the pelvis. This is the sacrum, which is the base of the spine. Here's your tailbone right here, right? And then this is your thigh bone here that comes and attaches to the hip joint. Now, the outside of the thigh bone right here is called the greater trochanter. And that greater trochanter is an area where a bunch of different muscles come and attach. One of those muscles is called the piriformis. So that piriformis starts off at the sacrum and goes all the way out to the greater trochanter. And that piriformis muscle is an important muscle that's in charge of externally rotating your hip, spreading your legs to a certain extent, and even uncrossing your legs or crossing your legs. This muscle is a thick and important muscle that, quite frankly, oftentimes gets irritated in one way, shape, or form, and sometimes can be the thing that's causing sciatica, or the thing that's causing irritation to the sciatic nerve. Why is that? Well, the sciatic nerve actually travels, so right, it starts up here with all of these nerve roots here, and it travels behind the sacrum here, and it actually exits out of this hole over here to go down the leg, and it exits either underneath the sciatic nerve over the sciatic nerve, or actually sometimes through, sorry, I misspoke, not sciatic nerve. It actually travels underneath the piriformis, over the piriformis, or sometimes through the piriformis before it continues its journey down the leg. Now that's really important, because if that piriformis muscle itself gets aggravated, if that muscle tightens up or gets injured directly, or spasms for whatever reason, then, and if that nerve is traveling over, under, or through the piriformis, well, that piriformis muscle can tighten, spasm, and irritate that nerve. So that is something that can occur. Now, here's the deal. Howdy, Kathy. I just saw your message. Welcome. Thanks for joining. Here's the deal with the piriformis. I think that it's demonized. I think that although it's on my top 3 list of things that cause sciatica, the reason that it's on the list is people blame it, not necessarily because it's the frequent cause. But it is very, very common for us to blame the piriformis muscle to be causing the sciatica. Why is that? Why do we blame that? You know, this is something that's blamed by, I blamed it when I was a medical student and when I was a resident. You know, early on in careers in medical school, etc., we tend to point to things like the piriformis. Physical therapists, you know, manual therapists, etc., that are putting their hands on patients end up blaming the piriformis too. So why is it that we blame the piriformis so much? Well, the reality is that the piriformis is something that can oftentimes actually get pretty aggravated. But is it the chicken or the egg, right? Is it the thing that is causing the issue, or is it the thing that it is being caused by the issue? That's the big question that we always have to ask. Why do I say that? Well, the piriformis gets its nerve signals from the L5 and S1 nerves from the low back, which are the most common areas for there to be nerve irritation in the low back itself, and specifically the L5 and S1 nerves. So if the nerves are irritated up north and not sending the right signals to the muscles, well, then it's very common for the piriformis muscle to kind of freak out and tighten up and spasm. And yeah, it could be contributing to the sciatica, but the original sciatica, the original issue, could actually be coming from the low back. So the piriformis is something that can be involved either secondarily or primarily. But we shouldn't just leave it at, oh, I have some tenderness in my butt along the piriformis, and I have some symptoms going down my leg, so therefore I am going to blame the piriformis. So when there is actual nerve irritation at the piriformis, that's called piriformis syndrome, and that corresponds to pain in the butt at the piriformis itself and symptoms down the legs. Now, how do we differentiate piriformis syndrome from nerve irritation in the low back, which is called radiculopathy? Well, one of the ways is a thorough physical examination, looking at how things are moving. Because if we find that there's weakness in our foot muscles, like our toe muscles and things that come from L5 and S1, but there's not weakness to some of our other muscles like our gluteus medius and gluteus minimus, then, well, maybe the piriformis is the issue. But if we actually have some weakness or some problems with the gluteus medius muscle, so if you're having some pain issues, weakness higher up than where the piriformis is, then we have to go back to looking at the spine, because if the nerves are irritated up at the spine, they can irritate both the buttock, gluteus medius, and the piriformis. But if the nerve's just irritated at the piriformis, it's not going to hit those upstream muscles like the gluteus medius. That's a little bit thicker for you guys, but got really deep in there. So if there's anybody, any physicians or other clinicians that are joining in, then that's more geared towards you guys to kind of help determine, is the pain coming from the piriformis or is it coming from the low back? Okay. So number one, the most common thing is your spine, your low back. Even though that's not quote unquote purely sciatica, that does affect the nerve roots that make up the sciatic nerve, and it is the number one cause of quote unquote sciatica symptoms. Number two is piriformis. Maybe not in terms of of how common it is, but in terms of how common it is interpreted to be. The piriformis is often demonized, poor piriformis muscle. We oftentimes think it's piriformis syndrome when it's not necessarily so. Number three is that the piriformis Did I lose you?